you're definitely the guru of what I was saying in the beginning of this podcast of value-based healthcare in Canada. So maybe you can start things off there. Like what is value-based healthcare and how did you get into it? Like why should people care about value-based healthcare?
Yeah, it's really a passion of mine, so I'm really happy to be here and talk about it. So I've been working in patient advocacy, mostly in oncology, since about 2008. And I started off working in palliative home care at a time when in Quebec, we were actually working on the Dying with Dignity Act, which led to medically assisted dying or MAID. In Quebec and across Canada, of course. And what I saw there was really the power of patient advocacy, how patient advocacy organizations could really influence public policy and the amazing change that we can do. But also, it really brought me close to patients. I was also volunteering at the same time with people with palliative care, and I really got to see the impact that it made when you listen to patients. My background is I did my bachelor's in psychology and behavioral science at McGill, and applied linguistics. So the value of language is also really important to me. And then while I was working in palliative care, I did an MBA in French at HEC Montréal, my third language. And I really wanted to apply best business practices to the public and nonprofit sector. And I started getting involved with this, the Coalition Priorité Cancer au Québec as a board member. And so I really saw how we were, again, able to really influence public policy and lift up the voices of people affected by cancer. So I've been doing that for a while. And I saw that there were really issues with the fact that science and medicine was advancing at such a rapid pace, but that our government policies, our reimbursement and access policies were definitely not going at the same pace. And I was seeing all of these amazing innovations in terms of precision medicine in particular, and how inadequate our reimbursement and access systems were, because the model is based on this like super old way of doing things, and even old like medicine, right? Old, like they're 20, 30 years behind. And so I realized that we needed a shift in the paradigm. We needed to think differently. And our current system is really, it really prioritizes cheaper drugs. It prioritizes, let's try the same thing on everyone and hope that some people make it through. And whoever makes it through can then have access to the newer thing. And then whoever makes it through that second step, maybe the third. Why should we wait 1, 2, 3, 4, 5, 6 lines of treatment to get the right treatment? Okay. Why? Because our current system is meant to just make everyone go through the little, production line of, everyone in a row, and whoever makes it to the end, maybe if you're lucky, you're going to get the right treatment at the right time for the right patient. Our current system is not made to prioritize that. So why value-based healthcare? The first thing that really lit me up and made me realize, okay, we need something different, is that realization with CAR T therapies that were coming on. They were coming down, and Quebec, as you know, was a pioneer in giving access to CAR T therapy in Canada. And I saw that our system was not meant to encourage that type of access to innovation. And because it's very expensive, yes, but what are we getting for our money? And so, really, to simplify it, to vulgarize it, value based healthcare is prioritizing value defined as an actual improvement in the health outcomes of patients. So, value from the perspective of patients relative to the cost, but not at one point in time like we're currently doing now, but the cost over the whole trajectory of care. So you're going to prioritize treatments that avoid hospitalizations, that avoid complications, that improve health outcomes. And that's not what we're doing. What we're doing is we're prioritizing the cheap thing, the old drug that's on a generic or biosimilar now. Like, but does it work? Are people doing better? Does it work for everyone? No. And so value based healthcare really says, let's actually base our decisions on not how much it costs, but what we're getting for our money. And what we're getting for our money in a more holistic sense. In a holistic sense, when we're talking about like, how does it impact patients? How does it impact families, communities? How does it impact the system? In Canada, what's more important than how much it costs is how do we better utilize our very, very extremely limited resources? How are we more equitable? And so I had that realization in 2019, and I did an executive ed program at the University of Texas, Austin, with the co founder of the value based healthcare movement, Elizabeth Teisberg. So Elizabeth Teisberg and Michael Porter wrote a book, Redefining Healthcare, in 2006, that really changed everything and that outlined value-based healthcare. But Michael Porter gets all the credit. He's very famous in business strategy. Anybody who has done an MBA has read his articles and his work. But it really started, and this resonated with me. It really started because Elizabeth Teisberg had three children that were sick children, and they needed to navigate the health system. And she's a systems engineer. She was also a Harvard professor in systems engineering. And she's like, there has to be a better system. We got to do this better. She got together with Michael Porter and they wrote this book. And so that resonated with me. I was like, I'm defending patients, but our system is not made to help them. It's made
Yeah.
to, what do we measure today, right? And it all gets down to measuring, improving what we measure. And that's why I think that Exactus is, really well placed to understand the value of value-based healthcare, because you need data to make better decisions. You need data in real time. And what is the data that we're measuring to improve our healthcare system today? It's volume. It's just we
Yeah.
have a health services system. We don't have a healthcare system. We're measuring the volume of services. We're not measuring, are people doing better?